to know what is going to happen to the children of this state.
This is the sound of the Federation fracturing.
It is a fundamental question. It is omitted from any modelling, and every single Queenslander must be included.
Palaszczuk yesterday walking away from the national reopening plan went down about as well as you'd expect this morning.
It's a desperate denial of the reality, and it's not based on the medical advice.
During a pandemic, we can't pretend that we're separate nations within one nation.
Selectively misusing the Doherty modelling breaches good faith and damages public confidence.
We can stand up to the LNP bullies and keep their virus out of our state.
Queenslanders have two words: back off.
Beyond the petty parochial point scoring, the key issue is kids. Our vaccination target, 80% of the over 16 population, only equates to 64% of the total population. Palaszczuk believes that leaves far too much fuel for the Delta wildfire to spread, especially among children.
Kids currently make up about 24%, this is the US, of the nation's COVID-19 hospitalisations. The quote is, "This is killing children, Mr Speaker."
But some experts are unconvinced.
Younger children are actually less likely to transmit than older children or adults. Younger children don't need vaccination at this point in time.
The best response, in a way, is what has been written by Queensland Health. Serious illness remains extremely rare in children, and I also quote, "The single most effective tool available to prevent infection in children is to reduce infection in adults."
It strikes me as a political move. I think that children should not be political pawns.
So is this about protecting kids, or is it a power play from Palaszczuk?
WHO Advisory Professor Mary Louise McLaws is here to help us answer that. So, Mary Louise, is Palaszczuk right?
Look, we do know that Delta causes more hospitalisation than Alpha, and Alpha was already highly infectious and more deadly. However, this one we don't believe is more deadly yet. It's unlikely to change. I think we've got 5% of kids under 19 and under in hospital. That's probably what she's worried about, and 0.6% of all ICU admissions are kids, and she probably thinks that that's too high as well.
Do you think possibly that the transmissibility of Delta among kids has been confused with the severity?
Certainly it's more transmissible than ever before. And in fact, there is evidence that Delta picks on anyone who's unvaccinated, and that is young adults. And in the UK, there's plenty of evidence of this, and young kids, as young as 5 now in the UK. They're very young kids. So to say it's not as transmissible from child to child or child to adult is not yet well understood. So we have to assume with Delta that kids can become not just a case, but can become a source of infection. So I can understand why she's concerned. She doesn't want kids to now get sick, go to hospital, or become a source to others.
The Premier says that she wants to see more research on this question of the impact on young people. But haven't we already got evidence coming in on real-life cases from all over the world? And it does seem to suggest that the effect on young people is not as severe as it is on older people. I suppose my question is, have we already got all the evidence we need?
Barry, I don't think we've got all the evidence at all, because Delta's only been around in the UK for a few months now, from about April. And they are the country that has done the best community-based research. And they still don't have enough data to be able to talk about specifically under 19-year-olds. They talk about under 50s. Sometimes they talk about, groups by 5 years of age, about how much prevalence there is in those age groups, but it's too early yet to talk about is it more deadly. Now, it's probably unlikely to be more deadly, but what I'd suggest is we have one model that the whole nation is using as an idea of how to respond. And I don't think ever before have we ever relied on a single model. We've got wonderful modelers around Australia, and they're all coming up with slightly different answers. And I would suggest that the authorities need to get all of the models together, all of the modelers in a room, to talk about probably a middle ground on how to include kids in the model and how to include kids in the plan.
Yeah, with that one model, only one model, you're already seeing Annastacia Palaszczuk accused of misrepresenting it. Today, talking about potential of, 80 deaths a day if we opened up without vaccinating kids. So if you had all these other models available, I can only imagine what would be going on. Do you think the criticisms of her have been fair on that front?
Oh, look, I think that no one should actually rely on one model, and particularly the Doherty model, because it was really done before they really got a handle on Delta. You know, the R0 was different, you know, that is the transmissibility, and of course the death rate, and of course the ability to contact trace. All of those are a bit, they're based on assumptions, as all models are. And, you know, they often say all models are wrong, but sometimes they're very helpful. And I think with this particular one, it's the same. All of them are helpful. They're not all right. And so I think the idea of being concerned about a particular number of deaths at the moment is probably premature on what we know about Delta.
Hey, Professor, how frustrating is it doing your job at the moment? The whole time that COVID has been around, we've heard from so many health experts who say so many different things. And I feel like the longer it goes on, the more these messages start to muddle into one another. How hard is it to get accurate advice across at the moment?
Well, you'd have to have advice from people who have no political alignment. And so you'd have to ensure that people declare their conflict of interest politically as well, their experience with running a pandemic. But also you need a whole bunch of multidisciplinary groups, not just epidemiologists and certainly not just modelers, but social scientists, people who understand how behaviour impacts, models that can't include behaviour. I mean, gosh, the first pandemic I ever dealt with was HIV, and I tried to model behaviour. It's very, very difficult. So we need actually real life learning about what behaviour is spreading Delta at the moment. And most of it is non-compliance. And a lot of that is due to stress, financial stress, people having to leave home to go and get food somewhere where it's cheaper, to go and eat with other family members because they, can't afford to eat at home. So, yeah, multidisciplinary groups, so you might be able to trust their opinions.
Well, we always trust you, Mary Louise. Great to get your thoughts as always. Thanks for joining us.
Stay safe.